On a le privilège d'avoir un troisième intervenant cet après-midi, qui est Jean-Michel Oppert, donc professeur de nutrition à Pierre et Marie Curie, Université Paris 6, et qui est le responsable du département de nutrition, cardiologie, la division nutrition, cardiologie et métabolisme en français.
C'est trop ça.
À la Pitié Salpêtrière. Merci beaucoup. Et donc, c'est un intervenant qui va nous parler des perspectives, de la vision interdisciplinaire et européenne. Il est particulièrement bien placé parce que je vois qu'il a été impliqué dans au moins 5 projets dans la suite FP5, FP6, FP7, DG Sanco, H2020 peut-être pas encore tout à fait, mais ça doit être en cours de préparation. Voilà. Et qu'en particulier, il est membre du steering committee du Health Enhancing Physical Activity Europe Network, donc très important. On se disait d'ailleurs avec Pascal Gâteau qu'il faudrait que peut-être on institue pour le système de fourniture de l'énergie des diapos des petits pédaliers pour que finalement on fasse en même temps un peu d'exercice, qu'on écoute les orateurs. Donc je ne sais pas, c'est une innovation technologique que on est en train de vous proposer. Je ne sais pas si ça fait partie des perspectives.
Alors, merci beaucoup. So, thank you. So thanks to the organizers, and especially the organizing committee, the PhD students. I'm very impressed by what you did. So it's a pleasure to be here in Bordeaux. Actually, I realized coming here, it was my first time ever in Bordeaux. Sorry? Yeah, from all my life, yeah. So it's really tough. So my talk will be focused on the research. So we just heard really a synthetic presentation of the organization of healthcare around obesity in France. So I will focus on the perspectives on research. So I come from Pitié Salpêtrière Hospital, so I'm the head of the nutrition department. It's a clinical department that is focused on the care of severe obesity, so very much along the lines of what was just explained by RL Pancreas on the Centers for Specialized Care in Obesity. For my research, I'm focusing on 2 lines of research. So one line of research is clinical research on obese patients and mainly lifestyle and behavior change. And another line of research is population research. And I've been working for the last 15 years with Serge Alberg in his nutrition epidemiology unit. And most of the population studies that we have been done with Serge Alberg. So in 30 years ago, I think obesity started to be seen as a subject of scientific interest and medical value. And then it was judged as prevalent, complex, especially in terms of determinant, serious because it has many complications, chronic, lasts a long time, and difficult to manage both for healthcare and prevention. Today, what we can say is that, obesity is prevalent. We have seen an increase. We have seen some figures today. It's complex. It's much more complex than we thought. And so we try to adapt system thinking to the problem of obesity. It's so serious that WHO has termed it as a disease in 1997. It's chronic, and we are talking more and more about patients' trajectory. And this is one of the important thoughts, I think, that have been applied in the National Obesity Plan. And indeed, it's difficult to manage, and we need a graded approach, both for treatment and prevention. So we could say, and there has been lots of obesity research in the last 30 years. So the question is, did this obesity research help in any way, and where to go? So what is really needed is to challenge our current thinking about obesity research, to identify the key issues and which may achieve something significant both at the scientific level, societal level, and economical level. So taking into account really the complexity of obesity, the obese condition, and so this is well known. This is from the UK Foresight report. Many of you know this figure. So it's an attempt to identify the determinants of obesity, their potential relationships. So it's really a nightmare. Fortunately, there is some grouping or clusters that have been identified, and as we all know, obesity is related to eating habits, food production, food consumption. It's associated with biology, psychology, society, and physical activity. So most of my talk will be based on some work that I have been associated to that took place 2 years ago from a conference that was organized in Brussels. And the title of the conference was From Biology to Society, What Message Can Obesity Research Deliver to Policymakers? So this was organized by a scientific society, the European Association for the Study of Obesity. So at the time I was actually the president of this association. It was hosted by the European Commission, DG Research, attended by approximately 100 obesity experts and commission officials, and the output was some research recommendations and outline of priorities. So the European Association for the Study of Obesity is one scientific society in the field of obesity, and this conference led to general research recommendations, also specific research recommendations, and more specifically the identification of some top priorities. So I will try to elaborate a bit on this, also to show the importance of interdisciplinary or transdisciplinary approaches in the field of obesity. So the general research recommendations were first to develop a transdisciplinary approach of obesity research, so integrating the biomedical sciences and also the social sciences. So I think the symposium today showed well that it can be done to integrate these two aspects. It is, I'm sure, familiar to you in public health. Perhaps it's less familiar for those strongly involved in biomedical science. Second recommendation was to develop a life course perspective of obesity, from preconception to determinants of obesity in an aging society. I think the topics today showed well the importance of this life course perspective. Also to develop a deeper understanding of the societal impact of obesity, and also, because this is really important, especially for Horizon 2020, I think, to develop an innovative view of the market opportunities and possibilities of economic growth offered by obesity research. And there were a number of priorities. So here I just want to show the 3 top priorities, and I would like to elaborate a bit on these priorities. So the first priority, and this came out through this conference. There were presentations, there were workshops, and this was really a bottom-up approach. So it's not just the thinking of a few researchers, it's really from a large consultation of the obesity research community in Europe. So the first priority was to try to improve obesity diagnosis to categorize individuals for appropriate prevention and treatment, I would say, and this is called Beyond BMI. The second priority was to evaluate the most promising strategies for prevention and treatment. Also to try to understand the large variation in response to treatment. This is an issue of great interest. And the third priority was to try to determine the characteristics of the obesogenic determinants, to validate instruments to assess these determinants, and to develop multidisciplinary approaches. So the first topic is what was called Beyond BMI. I think we already addressed this in a few talks today, but I just want to give you some of my perspective on this topic. So just to remind you why we use BMI. So we use BMI for two main reasons. First reason, BMI is related to body fat. Second reason, BMI is related to health outcomes, morbidity and mortality. As was discussed already today, BMI is an imperfect indicator of body fat. So these are really old data from our department, looking at the relationship between increasing categories of BMI with measured body fat by a precise method. And as you can see, on average, there is an increase. Increasing BMI is related to increasing body fat, but for each level of BMI, there is really a huge inter-individual variation in body fat. So this is important to take into account. If we look at the diagnostic characteristics of BMI compared to body fat, there are a number of studies like this one, but just to show you here, especially in women, on the left, on this side. So you can see that there are a number of subjects that are characterized as obese by BMI and who are indeed obese with body fat. So here, for example, so BMI is 33 and body fat is 41%, which is really a large increase. But there are a number of subjects here which are identified as non-obese by BMI, but who have actually increased body fat. So this is really an important issue about the definition actually of obesity. So since the WHO report of 1997, 2000, the cutoffs have been used worldwide, but we need to improve these cutoffs for a better definition of obesity. The second issue is related to body composition, of course, and we discussed that a bit today. There are many components of body composition that are included in BMI, and we should have better methods to identify them. Especially if we look at the relationship between BMI and health outcomes. This is the well-known U-shaped curve between BMI and mortality. What we don't know really well is the influence of body composition on this curve, and especially it's likely, but it's not really proven, that the increased mortality associated with increased BMI is related to increased body fat, whereas the increased mortality associated with lower BMI is due to decreased fat-free mass. And we really need better data on these types of issue to go beyond BMI in our approach of obesity. The second topic is trying to identify promising prevention and treatment strategies. I think we had a nice talk just before about this topic. What I would like to show you is, or to remind you about one French study that I think shows or showed promising results in the field of prevention of body weight gain. So this is the ECAPS study or intervention centered on physical activity and sedentary behavior. This was a randomized trial targeting individuals in their real-life environment, so targeting adolescents, also people in their environment, and with a focus on physical activity and physical activity environment. So the intervention was only on physical activity. It was delivered in schools, so it was not physical activity classes, but it was outside the curriculum. And this study showed, after 4 years, a striking 60% decrease in the prevalence of overweight after 4 years, comparing intervention schools in black compared to control schools in white. And I think this is really an important result. So of course we need meta-analysis, we need more general data to support this idea, but this, as you may know, has been taken in France as a model to promote physical activity in young people. And so the Institut National de Prévention et d'Éducation à la Santé has taken this study, this research study, as a model for the promotion of physical activity and also the fight against body weight gain. The real problem is the transferability, the external validity of these studies. And as you may know, one of the framework that is increasingly used to try to assess the external validity of these intervention studies is the REAIM framework. So this is from an EU project where we are involved. It was published recently, just to show you that REAIM is the acronym for Reach, Effectiveness, Adoption, Implementation and Maintenance of the intervention. And this is a way to assess the external validity of the intervention. Here, 4 interventions have been assessed, and as you can see, the scoring is much less than 100% for all these dimensions. So there is a lot to do in research to increase the transferability of the interventions that we plan. We talked about bariatric surgery a few times today. So from my clinical work, we are strongly involved in bariatric surgery. So I would like just to say a few words about bariatric surgery. So bariatric surgery is increasingly used. So it's really of concern at the ministry and for everybody in public health. There might be an epidemic of obesity, but for sure there is an epidemic of obesity surgery. And you know that last year, or 2013, 44,000 bariatric surgery procedures were performed in France. So in 5 years, 200,000 people will have been operated. So it's a large population, and it's a real public health concern. Nevertheless, as was said, bariatric surgery has incredible effects. I'm not a surgeon. I've been involved in obesity care for 25 years, and I'm still impressed by the results that we can see in our patients. 20% body weight loss after 20 years, compared to 1% with medical or traditional treatment, which is already an effect. And here, just for you to have the figures, 30% decrease in overall mortality. The first time we can prove that weight loss has a significant effect on mortality. So this is really an important result. And a striking 83% decrease in diabetes incidence after surgery. This is unheard of. I mean, never seen that. And it's not a surgeon who tells you, it's a physician. 40% decrease in stroke and some decrease in cancer. So this is really important to have in mind. It does not explain the epidemics of obesity surgery, but we really need to know these results. And the third topic I would like to briefly address is the one of the obesogenic environment. So looking at the physical environment, the social environment, and this is the theme where we really need interdisciplinary approaches. So about the physical environment, the built environment, there are more and more data and studies looking at the relationships between characteristics of the built environment where we live and obesity or obesity-related variables. So this is a recent review that we have been involved in an EU project, the Spotlight project, and there are indeed a number of variables from the built environment that are associated with body weight. And these are the variables. So walkability, it's a composite variable. Urban sprawl, so the dispersion of the buildings in the residential context, and land use mix, so how land is used between residential building, industrial building, commercial building, and so on. And so from the US studies, it is quite consistent that the more urban sprawl, the higher the obesity rate. In Europe, we don't really know, except in the UK, but I really suspect that on the continent, it might be different. So these are the variables that are associated with weight icons. So this is quite consistent. But these are only a few variables. So there is a huge number of other variables that are not really consistently associated with obesity. Perhaps one idea is to look at the interaction with socioeconomic factors. And so this is from one of our previous studies, showing that there is indeed a strong interaction between of socioeconomic status on the relationship between environmental characteristics and obesity. So what you have here is in adolescence, so this is from Chantal Simon. So it's the likelihood of overweight in adolescence in relation with access to physical activity facilities. So there is no access, medium access, or high access. So as you can see, and there is a stratification on the SES level of parents. As you can see, there is no association except in those who have no access to physical activity facilities when they are from low SES parents. So this is really strong. And what we know from these studies is that the socioeconomic factors are more strongly related at individual but also neighborhood level with obesity than the built environment factors. And what we really try to do in these studies is to try to more precisely assess the respective weight, if I can say, of these different factors on the obesity outcomes. And it's likely that depending on accessibility of facilities, food outlets or physical activity facilities, the weight of the physical activity, environmental factors and individual factors will vary. But we need to know more before we make public health recommendations. Another very important dimension to integrate is the social interrelationships. This is a nice study from the Framingham study. So perhaps you know this study. It was the study was modeled the interrelationships between individuals in relation with the risk of obesity. And so one of the interesting results is that if you have a mutual friend, second line, that is obese, and this person considers you as a friend, and you consider this person as a friend, you have a 200% higher risk to be obese. So you better choose your friends. Another very important aspect, of course, is economy. And I think in these studies, we should integrate economists So in some studies we do, but we need to have, in these transdisciplinary teams, I think the economists have a strong role. So this is just to show you some data. So it's a study from Oxford. So what it shows, without going into the details, apparently there is a strong weight of US data here, but the higher the economic insecurity, the higher the obesity rate. And I think this is really important. It really also emphasizes the importance of the type of economy we are living in. And these historians, actually from Oxford, they had this theory that it's really free market that drives obesity. And if you look at the data from the 80s or the 90s, it's when you had Thatcher and Reagan that really obesity rates boomed. It's a theory. And so the vision and the challenges is to really re-emphasize that obesity is a gateway to major NCDs, but we discussed that today. I really think obesity is a fantastic model for transdisciplinary approaches. This is for research, this is also for public health actions. It's also, of course, a social and economical issue. And one of the conclusions of our conference in 2012 was that obesity prevention and treatment will only advance if future research meets political commitment on both member states and European level. And I think we had a good example with the National Obesity Plan. There still is, I think, a strong will at political level to do something about obesity. And one of the axes of the National Obesity Plan was also to promote research. So I think there is a lot to do, especially for those who are still PhD students, to observe, to assess, to experiment in a variety of conditions and new experimental designs with a variety of tools, because it really can go from molecular biology to social science and humanities. So there is a lot to do. Thank you very much.